Welcome to Talk of the Bay. I'm Christine Barrington. For decades, Santa Cruz Community Health has faithfully pursued its mission to improve the health of its patients and the community while advocating the feminist goals of social, political, and economic equality. Well, both the health of our community and the pursuit of equity are under great strain these days. And on December 4th, our community is invited to come together in support of Santa Cruz Community Health and its mission through the art of poetry. And that's what we're here to talk about right now. The event is called The Power of Her Voice, and it features poet Ellen Bass and many others. And my guests tonight in the studio are going to share all the details, what inspired this event and what they feel, how they feel you will be inspired by it as well. So please welcome the CEO of Santa Cruz Community Health, Anita Aguirre. Anita, welcome.
Thank you.
Yes. And also the event lead and the person who was inspired to create this event, poet Patrice Vecchione.
Hello there.
Hi, welcome, Patrice. And one of the participating poets, Dion O'Reilly, who you might know already if you've ever listened to KSQD's Poetry Hive Collective. Dion, welcome.
Thanks for having me.
All right. So, Patrice, I'd like to start with you because I believe that this event was really sparked in your heart and you decided to step forward and say, I think we should do this. I want to create a benefit for Santa Cruz Community Health. Could you share with our listeners what that spark was?
It was twofold. One is I know the incredible power of poetry to heal, to cure, to focus us, to inspire us to action. And so there was this book that came out some months ago called Women in a Golden State, California Poets at 60 and Beyond. And I thought, there's something there. There's something I want to do. And knowing what's happening to funding for Santa Cruz Community Health, I thought, okay, there's something there. But why Santa Cruz Community Health? There are a lot of other organizations. I don't even live in Santa Cruz anymore. I live in Monterey. It starts back many, many years ago in the mid-1970s, 1974, when I needed help as a student at Santa Cruz High School. And I went to what was then Women's Health, Santa Cruz Women's Health Center, and I received guidance. And a few years later, after I graduated high school, I needed an abortion. So where did I go? That's where I went, and I was given a referral to a doctor who performed the procedure. So I know personally how important this organization is, and I love Santa Cruz. I may live down the bay a little bit, but I love it here, and I love the people. And I approached Anita and the other members at the health center, and they were like, yeah, let's do this. So we've been working on this since August, and we're really excited.
Yay. Well, and just in case somebody's tuning in right now and maybe they're about to get out of their car, could you just share right off the bat a few of the details of the event, where it's going to be held, what day, what time it'll start?
The Power of Her Voice will be held on December 4th, Thursday, at Temple Bethel in Aptos. There'll be 11 poets reading poetry from a collection, a new collection called Women in a Golden State, California Poets at 60 and Beyond. You know, women at 60 and beyond, we don't take a lot of crap. And so we're standing up. You know, we know where our alliances lie, where they stand. Part of what inspired this event also is something from Audre Lorde: your silence will not protect you. So knowing that our silence is going to actually hurt us, we need to stand up and use our voices, and in this evening, use them creatively.
Oh, that's wonderful. Thank you so much. And so I'd like to pivot to you now, Anita Aguirre, CEO of Santa Cruz Community Health. I personally, from what I've learned, being here at the station is where I learned about its history, and it just seems to me like one of the jewels of the county, a great, great gift to our residents. Could you please share with us with our listeners a little bit about Santa Cruz Community Health Centers, why they are important, and then I want to talk about the threats that are coming toward community health centers.
Sure. So we have been around since 1974. We were actually founded by a group of UC Santa Cruz students at a time when women's access to information was not what it is today, right? We didn't have the internet. Most of our OBGYNs were male. It was a male-dominated healthcare field, and yet we know that women are really the caregivers for their family, coordinating care for their children, for their partners, for their parents. And so Santa Cruz Community Health has evolved out of that space and that need. We are the family doctor. We provide full scope primary care to adults and children and women. That includes prenatal care as well as deliveries at Dominican Hospital. We've expanded over the years to also have a very robust behavioral health department with access to substance use disorder treatments and psychiatry, acupuncture and chiropractic, as well as optometry. So we are full scope, one stop, and we now serve over 13,000 community members, and we have 3 clinics. Our Live Oak Clinic, which is a brand new 2002 20,000 square foot state-of-the-art health center, and we have a clinic in Ben Lomond that we also opened in 2022. And then, of course, we still have our flagship Women's Health Center at down on Locust Street in downtown Santa Cruz. So, I think one of the great things about community health is that it responds to the needs of its residents, of the community, and it is that pivotal nexus for a lot of people in terms of information, such as Patrice described, but also actual care, as well as bigger than that, really building employment opportunities. We employ over 250 employees. So we are also not just a healthcare provider, but we're also a major employer. And just a little personal note, I started my career there as a volunteer when I was in college at the Santa Cruz Women's Health Center. So it's a real honor for me to have come complete full circle and now be in this role.
Wow, it's so epic. I've interviewed some of those founding mothers of Santa Cruz Women's Health Center. It is such an inspiring story, and particularly at a time like we have now, where people see the power of big money and these huge political forces mounting against us. And the story of the Santa Cruz Women's Health Center demonstrates what is possible when a few people just say, I'm going to get beep, done. So so thank you for that. And so now I would really like to have you inform us, what is Santa Cruz Community Health facing with the budget cuts of this administration? What are you seeing and anticipating?
We are in the middle of a number of scenarios trying to exactly figure out what is going to be the impact, because a lot of the changes that are coming out of the federal government are not immediate. So they're kind of phased in, and they're intentionally phased in to begin after the midterm elections of 2026. So we are strategizing internally with our executive team and our medical providers and our behavioral health providers, but we're also out there with our community partners. The biggest threat is going to be to the Medicaid program, or Medi-Cal, here in California. Locally, it is anticipated that over the next 4 years, up to 17,000 people could lose their Medi-Cal. And in large part, that is because of this concept of, what are they calling it? Theft and fraud and abuse. Yes, they want to address fraud and abuse.
So-called.
Right. And really what that is it's meant to intentionally put up barriers for really a lot of our vulnerable community members to just not be able to carry through with that. And so what that looks like is more frequent eligibility checks. Instead of being once a year, now every 6 months. That also looks like work requirements. Someone having to work 80 hours a month or be in school or volunteer. But it's really also the documentation that each of those require are really meant to, be that block that someone just says, that's just too much, I can't. There's a number of other things that are happening as well, pertaining to the redefinition of what is an eligible immigrant, and cutting a number of those definitions of who would be someone who's a legal immigrant, but who now there's like 10 categories of legal immigrants who could receive services and be on Medi-Cal, and that is potentially will be changing, as well as the definition of legal immigrants on Medicare. So there's a number. So there's the big obvious things that we know, and then there's a lot of little insidious things that are going to be coming up and that people aren't really aware of. So for us, that could look like a several $1 million budget hole in the upcoming years as our patients move from having health insurance coverage to being uninsured potentially. And that impact is not just, for Santa Cruz Community Health. It just is magnified throughout our healthcare delivery system, because we know when people don't have health insurance, they don't go for the routine care. They're really accessing care when it's sick, and they really can't do, one more day. And then that moves on to our emergency rooms, the most expensive place to receive health care. But that's what an uninsured community looks to, is those emergency rooms. We're essentially going back 10 years to before the Affordable Care Act, and so we're anticipating within our health center, our uninsured rate right now is 5%. So most of our patients have health insurance of some kind. The majority, that is Medi-Cal, which is a excellent form of healthcare coverage, and we see that uninsured rate going to 20%. And so that is a hole that, is really hard to be filled.
Thank you. It's very sobering and disturbing. And so I'm going to take a moment to reintroduce the show, and then I want to talk about some empowering options for the community. How do we show up? How do we help one another? There's myriad ways to do it, but in case you've just tuned in, you are listening to KSQD. That's on 89.5 and 89.7 in South Santa Cruz County and in Monterey County area, but right here in Santa Cruz, we are at 90.7 FM, and welcome to all our listeners listening from anywhere in the world at ksqd.org. This is Talk of the Bay. I'm Christine Barrington, and my guests are the CEO of Santa Cruz Community Health, Anita Aguirre, Patrice Vecchione, who has been inspired to create a wonderful event to benefit the community health centers. It's called The Power of Her Voice. It's going to be happening at Temple Bethel December 4th. And it's about poetry. And so we also have poet Dion O'Reilly joining us. And so going back to you, Anita, after that very sobering news, could you help us understand how we can help, what we can do?
Yeah. I think that the most important thing we can do is not be silent. That things are not set in stone. We have, and there's a couple ways around that. One is, talk to your legislatures, both at the state level and at the federal level, because a lot of these changes that are happening at the federal level flow down through the state. And the state has not even begun to adjust their budgets for the bill that was passed on July 4th, H.R. 1. So the tidal wave has not yet fully reached us. The other thing I would say is get out and vote. Super important. If we can reclaim the legislature, reclaim the House in the next midterm election, it's the House that sets the agenda. And then the Senate. So I think, again, as you open so eloquently with Audre Lorde's quote, we cannot be silent, and we will get through this. This is just a period of our history, and we will be out on the other side, but we will look very different. And I think just sort of like COVID, we came out of COVID, but we sort of looked a little different as a society. And I think this is one of those generational impacts that we're going to have to find our way through.
Yes, and I love to focus on empowering messages, and I'm going to say not only vote, but talk to your friends and family members and encourage them
Absolutely.
To vote. And is there any word at all about the California budget? Do you hear talk coming from our leaders about how they might meet this challenge?
I think that everyone's really sensitive now to the fact that the federal budget, the impacts of the federal budget. The legislature will start up again in January, and so that is the time for those conversations to begin. Our state assembly, Laird, Pellerin, Addis, they should all be home right now in December for local meetings. And so it's just really important to really share the impact. It's not just like, don't vote this way or vote yes on that, but what's the impact, right? What is the impact of that decision, and what is that going to look like? And that's the story that we're working on telling as well.
Great. And I'm sure that KSQD will be inviting leaders from Santa Cruz Community Health to come back in, keep us informed, and help us know what we can do, because what happens to the people that utilize Santa Cruz Community Health happens to all of us. I know many people who are on Medi-Cal. It's phenomenal. It has helped them so much. And it hurts when one of our community members is hurt. It hurts us all. And Patrice, you're nodding your head. And Patrice, you're a poet. Dion, you're a poet. And so I want to bring the poet voice in. And so, Dion, we haven't really heard from you yet. I want to ask you, because you come on this station regularly to share the beauty and power of poetry. Why does poetry matter?
Well, when I was listening to Anita speak, I felt grief and loss, and that's not something that's always easy to express. And poetry is a great way of doing that, but it's not going to be doing it in a victim-y kind of way. It's going to be doing it in an empowering way, really, because within the grief will be discovery of some sort, and it will be balanced with hope and beauty, too. So I think that's the major way that poetry can treat something like that. And when I was listening to Patrice talk about her personal experience of being a teenager, basically, confronting a pregnancy. And there's a million things that's going through someone's mind when that is happening. You're growing up fast when that happens. And poetry can pick those kinds of things apart and also speak to how comforting it is to be able to go somewhere and be taken care of. Because maybe your family's not taking care of you. Maybe the world is not taking care of you. Maybe the world is stigmatizing you. Maybe you're completely lost. And to have a place where you're loved, really, basically, is something that poetry can really express. And then the grief of having that taken away, and then what's under that, and what's under that, and what's under that.
That's so beautifully said. You really dropped in like a poet there. And in case you've just tuned in, why are we talking about poetry and abortion and community health? In case you missed the intro, there is a benefit event happening on December 4th at Temple Beth El. It's called The Power of Her Voice, and it's poetry reading in support of Santa Cruz Community Health Centers. And the organizer of this event is Patrice Vecchione. She is also a poet. And so, Patrice, I saw you nodding and responding to Dion there. Would you like, what was going through you as she was speaking?
Well, it is poetry that helped me to get through that time, both the writing of it and the reading of it. I was a young cocaine addict, and I read Adrienne Rich's book, The Will to Change, and I thought, I can have a will to change, and I did. And when I was going through having an abortion, I didn't tell my family. I couldn't tell my mother. It would have been a horrible thing. She would have disowned me sooner than she did.
I shouldn't laugh.
Well, no, you got to laugh at this stuff. Really, you got to laugh. But it was through reading poetry and through writing poetry that I was able to get through that particularly difficult time. And knowing that I had the support of the Women's Health Center, knowing that I wasn't alone. You don't feel alone with poetry when you're reading poems, and at an event like this, we want to come together. So we all feel nervous many of us feel frightened. You know, I'm probably not going to be hurt myself. I'm on Medicare. Who knows? I'm old. But my neighbors and my friends and the people I love, we don't stand alone. We stand together.
Mm-hmm.
And
That's right.
I have friends and students, adult students, who are afraid to speak out. 75-year-old women have said to me in the last few weeks, I cannot say the truth to my family. Mm. Well, damn it all, then I'm going to speak louder. Mm-hmm. I refuse to be silent. Mm-hmm. Poetry is one way. Phone calls, letters, coming together is an enormous way.
Yeah, I think that the benefit of the benefit of going to hear all the poets read is not only are you contributing financially to the cause, but you are going to hear the voices of women speaking their truth in really deep, beautiful, insightful ways. It will be, I mean, it's usually a sacred event when people are speaking through poetry.
I can feel it, and I see you have the book open in front of you. Do you have a poem you're willing to share with us?
Well, this is my poem in this anthology, and it's called The Sadness of Things, and the sadness of things is a phrase from Ruth Stone, a poet, and it's a sonnet. The sadness of things. I have nothing to say about the overgrown plot where I buried the cat, a secret only I remember, or the emptiness in the sunroom corner where my odious one-winged parrot lived for 50 years. This living room, I raised my children here. Their broken ghosts accuse me from the corner of the gritty settee. Listen, there's a dull hum in the unplayed piano. Some might call it song. Nothing I say is as beautiful or lost. That's the way of lyrics, as close as we get to the endless purity of things, their birth cries, their sadness.
Thank you. I love how poetry seems to like slow down time and open a portal into this other dimension.
Exactly.
You're lighting up, Patrice.
Well, I just felt it. Soon as Dion started reading, I felt myself settle, and I got tears in my eyes, you know, thinking of the settee and the actual sadness of things. I felt like I was in the living room with her. You know, normal chatter doesn't do that. The capacity of poetry is enormous, and it's healing. It really is a form of medicine. So we really want everyone listening to come on the 4th. We have tickets available in advance. If you just go to the SQD website, you can get the link to the tickets. You can come to the door at Temple Bethel and Aptos. We'll have tickets available there. But please come out and let's soothe each other. Let's get in there to the sacred space.
You'll feel different afterwards.
I feel different now.
I already feel different. And I just want to say I do a lot of research into movement building, what builds power, how people stand up to authoritarianism. And the number one thing that works is first building community, strengthening community. So coming together in a room, coming together and dropping into this sacred space is so nourishing, so helpful, and we can do it in support of this phenomenal gift to Santa Cruz County Community Health. And so, Patrice, I think you have a poem. Let's go out on a poem.
I'd like to read a poem by Linda Serrato, who will be reading this on December the 4th. It's called Nostalgia. I remember the sound of streetcars rumbling on wet tracks, the sight of one pushing out of the fog, the clatter of coins as they dropped through the coin machine, or the hole puncher biting into a transfer to be used to board the next streetcar. I remember the lullaby of foghorns, the buzzing of overhead wires for electric buses, the immense size of their brakes, the whoosh of their doors closing. Ah, what I would give to be carried away in a giant rolling cocoon, gazing out windows, neon lights barely visible through the salty mist, so otherworldly, so like a dream, so what it's like to go home.
Nice. So what it's like to go home. So I just have to sneak this thing in, that Santa Cruz Community Health was birthed through the efforts of young women. We've got 3 women here in the studio. These are women writing poems. And I just was exploring a study today showing that nonviolent movements in opposition to authoritarianism are 7.5 more times powerful when women are leading it.
Wow.
Nice. Okay. Wow. So y'all are doing it. Thank you so much for joining me on Talk of the Bay. Anita Aguirre, CEO of Santa Cruz Community Health, Patrice Vecchione, the event organizer and a poet, and Dion Riley, part of KSQD's Poetry Hive Collective, and a poet that will be reading on December 4th at Temple Beth El, 7 to 9 p.m. You can get tickets at the door. It's in a very large room, folks, so come on out and fill that room on behalf of Santa Cruz Community Health. Thank you so much.
Thank you for having us.
Christine.
You've been listening to KSQD 90.7 FM, KSQT 89.5 FM, and 89.7 FM. We are K-Squid, community radio for the Monterey Bay area. I'm Christine Barrington with Talk of the Bay. Join us for more great stories about the incredible people and natural beauty of our region every weekday at 5 p.m. right here at KSQD.